Hey everyone, welcome back to the channel. Today, we're diving into a topic that affects millions of people but often goes unspoken: bad breath. Now we've all been there, right? That moment when you're talking to someone and you suddenly wonder, is my breath okay? But what if I told you that bad breath isn't just about what you ate for lunch or forgetting to brush your teeth? It could actually be a sign of something deeper going on in your body. In this video, we're going to explore the medical conditions that cause bad breath, how to identify them, and what you can do about it. Whether you're here for yourself or someone you care about, stick around. This is going to be eye-opening. Let's get started. Before we dive into the medical stuff, let's start with the basics. Bad breath, or halitosis, is usually caused by bacteria in your mouth breaking down food particles and releasing foul-smelling gases. Think of it like a tiny garbage dump in your mouth. Gross, right? Common culprits include foods like garlic and onions, smoking, and poor oral hygiene. But here's the thing, if you're brushing, flossing, and using mouthwash regularly, and your bad breath still won't go away, it might be time to look deeper. That's where medical conditions come into play. Let's break them down. First up, let's talk about your mouth itself. Did you know that your oral health is like a window to your overall health? Conditions like gum disease, tooth decay, and dry mouth can all lead to chronic bad breath. For example, gum disease, also known as periodontitis, causes your gums to become inflamed and infected, creating a breeding ground for odor-causing bacteria. And if you've ever woken up with a dry mouth, you know how unpleasant that can feel. Without enough saliva to wash away bacteria, bad breath can quickly take over. The good news? These issues are treatable. Regular dental checkups, proper brushing and flossing, and staying hydrated can make a huge difference. But if your bad breath persists, it might be time to look beyond your mouth. Next, let's move up to your respiratory system. Conditions like sinus infections, chronic bronchitis, and even tonsil stones can cause bad breath. Sinus infections, for instance, lead to postnasal drip, basically mucus dripping down the back of your throat. This mucus is a feast for bacteria, and the result? You guessed it, bad breath. Then there are tonsil stones, those little white chunks that form in the crevices of your tonsils. They're made of bacteria, food particles, and dead cells, and they smell terrible. If you've ever coughed one up, you know exactly what I'm talking about. The key here is to treat the underlying condition. Whether it's antibiotics for a sinus infection or a simple tonsil stone removal, addressing the root cause can clear up your breath for good. Now let's talk about your gut. Yes, your digestive system can play a big role in bad breath. Conditions like acid reflux, H. pylori infections, and even liver or kidney disease can all contribute to halitosis. Acid reflux, for example, causes stomach acid to flow back into your esophagus, leaving a sour smell in your mouth. And H. pylori, a bacteria linked to stomach ulcers, can also cause bad breath. But perhaps the most surprising connection is with liver and kidney disease. These conditions can cause distinct breath odors like a fishy smell for kidney problems or a musty odor for liver issues. If you notice these kinds of smells, it's definitely worth talking to a doctor. Finally, let's talk about systemic diseases, conditions that affect your entire body. Diabetes, for instance, can cause a fruity or acetone-like breath odor. This happens when your body starts breaking down fat for energy, releasing ketones into your breath. Kidney and liver disease, as we mentioned earlier, can also cause unique breath smells. These conditions are serious, and bad breath might be one of the first signs that something's wrong. The takeaway? If your bad breath comes with other symptoms like fatigue, pain, or unusual odors, don't ignore it. Your body might be trying to tell you something important. Okay, so we've covered a lot of ground, but what can you actually do about it? Here's the game plan. 1. Start with oral hygiene. Brush twice a day, floss daily, and don't forget to scrape your tongue. 2. Stay hydrated. Water helps wash away bacteria and keeps your mouth moist. 3. See a professional. If your bad breath persists, visit your dentist or doctor. They can help identify and treat the underlying cause. 4. Address medical conditions. Whether it's managing diabetes, treating acid reflux, or addressing kidney issues, tackling the root problem is key. Remember, bad breath isn't just a cosmetic issue, it's a health issue. And the sooner you address it, the better. Alright, that's it for today's video. I hope you found this deep dive into the medical causes of bad breath helpful. If you did, don't forget to give this video a thumbs up, share it with someone who might need it, and hit that subscribe button for more health tips. And remember, if you're dealing with chronic bad breath, you're not alone, and there's always a solution. Thanks for watching, and I'll see you in the next one. Take care of yourself and keep smiling.